The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. Excited for today's program, excited for today's guest. Gonna jump right into it. From Ozark Dental Lab, I have Samantha Graham. Say hello.
Hello, everybody.
It's great to have you here.
Thank you.
Yep. Very thankful for your time. I'm very thankful for your share today. Samantha, let's just jump right in. First question that we always ask: how'd you get involved in dentistry? How'd you start helping dentists?
Well, for me, it's always been a family business. I'm third generation working as a dental technician. My grandfather was a dental technician. My father, two of my uncles are dental techs. I literally, as a toddler, grew up on the floor of a dental lab. So this has been in my blood for a long time. No matter how many times I've, gone away from dentistry, I've always come back to it because it's a passion. And it fills me in ways that other things can't. So I've been doing this for a long time now.
Yep. So it's cool. That's, I know someone else kind of similar story, their whole life. I think that's great. Well, tell me in your travels and, when you're getting phone calls from dentists that have, or their team members, what are some of those major issues that you see practices having right now that maybe you didn't see having before? So what are some struggles that dentists are having?
Probably a large struggle that we're seeing with a lot of dentists is kind of the digital revolution. Dentists, have worked with things like PVS impressions and things like that to be able to take impressions of their patient's mouth to have products made. Digital came on the scene really big for dental laboratories and dentists, in the early 2000s. We really started seeing an uptick about 2010. And so now there's all of these digital ways to take impressions, but it's a huge learning curve for dentists. It's a huge financial burden to purchase these systems. So a lot of struggles that we're seeing with our dentists is, they're wanting more information. I'm really hearing I need to go digital. I'm having patients ask do we do digital impressions? Because a lot of patients don't like having to take the old fashioned impressions. And having stuff in their mouth. So they have patients coming to them and saying, do you do the digital impressions? I don't want an old fashioned impression. I don't like the way all that gook feels in my mouth. And so dentists are like, what do I do? There's all of these different now digital companies that are selling these digital impressions. Some have better customer service than others. So some doctors aren't getting the help they need to learn how to use these systems. And then they're also having to, like I said, having to pay out a lot of money for these systems. And that's a huge financial burden to some of our dentists, especially who already have the huge overhead of, still paying for their dental school, having to set up their own practice and all that involves. So that's something I'm really hearing from a lot of my dentists is trying to catch up to this kind of digital side that's really starting to get prevalent in dentistry.
Yeah. Makes a ton of sense. So let me ask you this question. Maybe you have some insight into this because I'm seeing this on some social media groups and channels that someone bought a scanner and now maybe it's not compatible with a different system or a lab that they want to work with. There's a couple of name brands out there that I'm not going to mention just because I don't want to be inaccurate. But it is a complaint that, I'm stuck because, my scanner only works with this, or this only works with this scanner. How can you avoid some of those pitfalls? How can you make sure that you don't get yourself locked into a product or a subscription that doesn't give you flexibility in the future?
And I would definitely advocate to any dentist that's wanting to go digital, ask a lot of questions. Ask anyone that you know in the industry, whether it's other dentist friends. What are you using? What are you seeing? What do you like what it's done for your office? If you have a good relationship with your dental lab, talk to your dental lab. Say, who is using what scanner? What are you seeing on your side? Because we hear from dentists that go, I absolutely hate this scanner. I hate everything about it. They sold me on it. Next thing I know, I've purchased it and I'm making monthly payments on it and it collects dust.
Right.
because it's got a steep learning curve. I'm having to retrain my whole office how to use it. And like you said, some labs may not be on that system. So then if the lab is not on that system, then you can't send them the work.
Sure.
And
Yep.
so I would definitely tell anyone in the dental field, ask a lot of questions,
Yeah.
talk to anyone that you know that is in the field with you and get their feedback because it's such a big expense. You don't want it to just sit in the
Right.
corner and not use it.
Yeah, and I think this is a good time to bring it up that if you're not working with a lab that you love right now, or a couple of labs that may specialize or be a little bit more gifted in one area or the other, you should work on finding one that you love because it'll save you a lot of time and
It will.
aggravation. Yep.
It will. And, I love to hear dentists that have good relationships with their dental lab because I always strive to have a good relationship with my dentist. So if you have that good relationship with your dental lab, lean on them because they will, because for instance, in our lab, I will hear from a lot of different doctors. Okay. Some doctors like this about this scanner. They may like this about the scanner. They don't like these things about these scanners. So we hear a lot of things from a lot of different dentists. And so if you have a relationship with the dental lab that you can lean on, use that. Ask
Right.
them, what are you seeing from your clients? What are they telling you? Because sometimes the dental lab will have some great information that they can give you on that.
Sure. I think in general that a lot of dentists probably don't use their lab for as much as a resource as they should, right? They kind of get busy. It's kind of out of sight, out of mind. They're ordering labs and getting them, and all is great. But there has to be a way that dentists can also help participate in building a better relationship that provides saves money, right? Increases quality and provides better dental care. You're shaking your head, yes. So I think you agree with
Yes,
that. What are
I
some? Yeah.
I always tell my dentist, of course, call me when something's wrong, but call me when things are right. I can help. I love to help in any way that I can. And I feel that most dental labs are like that. They want to help their dentists be successful. Because if you're successful, I'm successful. And
Right.
so it's a very symbiotic relationship. So I always encourage dentists find a lab that you can have that good relationship with. That they're not just sending you products, but you don't know their names, the names of the techs or the names of the people that you can call, because they can be a great resource for you and use that because it can help you in your practice in so many ways.
Yeah, makes a ton of sense to me. Let me ask you about your dental lab, right? So let me just kind of ask you, what is something that you really stand out for and that you've become known for? And again, the website's ozarkdentallab.com. And then also let me ask you this question first. Do you work with dentists just in Texas? Do you work with dentists all over the country? Who do you work with?
The majority of my dentists are local. I'm in Dallas, so I would say 90% of my clientele is in the DFW area. I do
Hmm.
some work for dentists in tech all over the state of Texas, and I do some work for some doctors out of state. What we've always tried to do is, a dentist can go anywhere to get a crown or a denture. But what we try to do is to build that relationship. I want to know, doctor, how are things going for you? We try to also stay abreast of new products coming out so that we can tell our dentist, hey, we're really seeing a lot of patients coming in and asking for this product. You should know about
Right.
that. That way, if a patient comes and asks you for that product, hey, you know someone that can do that.
Sure.
That's what we try to concentrate on is the business side of the relationship because it makes everything so much easier and so much better when we can have a personal relationship with our dentist and our clients.
Yeah, that makes sense. What are some popular things right now? What are some things that are trending that you're seeing
Oh,
that maybe you didn't before?
3D printed everything is
Mm,
trending right now. We new 3D printed dentures, 3D printed partials, 3D printed mouth
printers.
guards. That's where everything is going. I,
Yeah.
and when I first saw the first 3D printer, and other industries come out, I never would have thought we would be sitting here talking about 3D printed dentures. But that's the biggest thing that's the biggest thing we're hearing our ear to the ground with dentists saying, hey, I have someone's asking about 3D printed dentures and I have someone asking about 3D printed mouth guards. And that's kind of what is kind of the big buzz right now
Yeah.
is everything getting 3D printed.
Have you seen anything? This is might be a difficult question and setting you up for disaster here. So I apologize for that. But is there anything, have you, I like, I don't know anything about dental labs, right? Except for what they do and who they serve. But I'm not a
Right.
dentist. People know that, right? I don't get into the clinical side. I get into the business growth side with dentists. That's what I specialize in.
Mhm.
I love Car and Driver magazine, and one of the things that they do in that magazine is they talk about concept cars, right? And right now in automotive, they're talking about hydrogen cars, and some of this cool technology that may or may not happen. Is there any buzz out there in the dental lab world and dentistry world of some things that might be coming? It's not there yet, but some things that we might be seeing come in the dental industry that could be a game
N-
changer?
Not that I'm hearing, it was the digital stuff that used to be the around the corner. In 10
Right.
years, you'll hear about digital stuff. The 3D printing kind of came out of nowhere. I really didn't expect that to start because we just started hearing a lot about 3D printing probably in the last 2 years. And we just now have just started, 3D printing stuff because I'm like,
Yeah.
3D printed, what is that? That's kind of the thing that just kind of jumped at us. Digital was kind of the thing we used to all talk about. 10 years ago, we'd go, oh, look at, you hear about digital stuff. We hear about digital impressions. Do you think that's
Right.
ever going to do anything? And so that used to be the talk about what was going to happen around the corner. I haven't heard anything new. I don't know. I kind of hope we kind of stabilize for a little bit before we start
Yeah. Right.
hearing about more stuff coming out because a lot of my clients don't want to hear about new stuff coming out. They're like, I'm trying to catch up with the digital stuff. I'm trying to catch up. And, and patients nowadays, with social media, I think a kind of a thing we're seeing too is patients are coming to doctors and saying, oh, I saw this on social media. I want this.
Right.
And
Yeah.
because it used to be, the, a lot of patients didn't know about dental labs. A lot of patients
Right.
didn't know about, the difference in products and everything. But now dental labs are kind of getting more into social media. So now dentists are saying, well, I got a patient come in and says, I want a Valplast or I want this. And they don't even know what it is. And
Right.
so the doctor's like, wait a minute, that's not how this works, you
Yeah.
know? And so it's kind of this digital online revolution that's kind of happened in the field is kind
Yep.
of the big change that we're seeing right now. And a lot of dentists I know, I think some of the younger dentists, are going to, be more, you know, accepting of this whole thing. But I've got some other
Sure.
dentists like, I don't want to learn new stuff. I'm 10 years from retirement. I don't want to,
Right.
and I agree. I'm like, I'm
Yeah.
there with
Very
you,
good. Yeah.
you know?
Yeah.
And so,
Glad you're
but
working.
it's a kind of a different environment now where a lot of dentists are saying, I have patients come in saying, oh, I saw this on TikTok,
Yeah.
what
Right.
is this product?
Yeah.
You
Well,
know?
it started. I mean, it's gonna get more and more. It's gonna just
Yeah.
happen more and more and more. I mean, I
Yeah.
think people can see with Smile Direct. I mean, they changed the game.
Exactly. Yeah.
Dislike Smile Direct, which I understand why. But there's a lot of people that ended up with a competitor in a dental office because they saw a Smile Direct TV commercial,
Hmm.
right? They ended up going with Invisalign or Clear Correct or whatever other brand
Right.
after they saw a Smile Direct commercial. So it's not necessarily a bad thing, right? Making people aware is not necessarily, I think, a bad thing. So
Oh,
when
and I
patients,
agree. And like you mentioned, Invisalign has always had I always felt a very good public campaign on letting
yeah,
people know, about like clear braces and stuff. So I
sure,
do believe there's definitely some benefits to patients being more educated about
yeah,
what is out there. So I definitely think there's a benefit to that as well.
yeah. So Samantha, last question I got for you is: somebody wants to learn more about your lab, learn more about you and what you guys all do down there, the DFW area. Tell us what's the best way for them to reach out and learn more about you.
Check out our website. It has, all of everything that we can do for you. Always, I always encourage, reach out. I have us send us some information to you, about all the products that we do, the different customer service aspects that we have, and just see if we would be good fit. I'm the first to say, we may not be the good fit for everybody, but we love what we do and it shows in what we do.
Yeah,
And so we definitely want to be available to any dentist that would like to try us out.
yeah, makes sense. Samantha, thanks so much for being here. It's ozarkdentallab.com. Please come back.
I appreciate it. Anytime. Thank you so much.